Welcome, everybody. As people are trickling in, we'll get started. Welcome to Why Large Health Organizations Are Going Google. Very proud to have 4 of our customers. I'm the CEO of SADA Systems, and we have 4 customers here that we've been involved in helping them with the journey to G Suite and to the Google Cloud. And it's great to have this tremendous representation up on stage. This is really a story about their journey. So I'll just jump right in. I'll have each of them introduce themselves so you get to know where they work, what they do, and then we'll get going after that. Scott.
Sure. Hey, everybody. I'm Scott Alderman. I'm the VP of IT Operations and Service Management for SCL Health. We're based out of Denver, Colorado, Broomfield, really, kind of a metro area. We have a total of 10 hospitals. A couple of them are what we call micro hospitals. 3 up in Montana. We've got 4, 5, 6 in the Colorado area or the Denver area, and then we have 1 out what we call the Western Slope out in it's called St. Mary's, Grand Junction, Colorado. About 17,000 associates, even though it seems like it's growing all of a sudden because they're like, we need more license. So, but we are in the middle of our journey. In fact, we have just gone up recently with our early adopters, and then in about 10 days, we're going up with about 9,000 associates. And then we've got another couple weeks after that we'll be going up with another 5,000. So rapidly moving that direction with our G Suite implementation, and things are going well.
Thank you. Good morning. My name is Elizabeth Cooper. I'm Director of Communications and Engagement for Leahy Health. We're a healthcare organization on the northeast part of Boston, and just a year ago Friday, we had our first of what ended up being 6 implementations with Google last year. So this is a fitting anniversary for us to be here today to talk to you about our journey, and I'm looking forward to questions too that are specific to yours.
Good morning. Tony and everybody else, thanks for coming. Jason Roberts, I'm Director of Information Services for Barton Healthcare. We're a organization located in South Lake Tahoe, California. We have 2 hospitals, 1 in California and 1 in Nevada. And we've been on it for about 2 years now, so I'm excited to share what our journey is and some of the challenges. And so thanks for coming.
Good morning, I'm Jim LaPlante. I'm the Senior Director for IT Technology and Biomedical Services at Cambridge Health Alliance in Massachusetts. The Alliance is made up of 3 hospitals and 15 health centers operating in the Somerville, Cambridge, and what's called the Boston Metro North region. We're a teaching hospital, and we operate as a safety net. We are also with a strong emphasis on behavioral health and, excuse me. I just forgot the song.
Behavioral health.
No, that's great. Again, I really appreciate you guys being here. I think it was very indicative of the keynote. Diane Green herself said that healthcare was the first vertical that Google focused on in their journey to become vertically focused, and now following that model, they're entering other sort of vertical specialities in how they go to market and the solutions that they package. And what's really interesting for me, being a student of the cloud and being in the business for so long with Google, literally since 2006, is healthcare has all of a sudden in the last 3 years has gone from maybe the most cloud unfriendly, cloud fearing vertical to really the one that's adopting cloud maybe faster than any other industry that we're involved in. And I'm really curious from your standpoint, and I'm sure many of the people in the audience are just as curious. I really want to start with that first decision to evaluate Google, evaluate cloud. How did that even come about as sort of a possibility? And since Jason's holding the mic, I'll let you go first.
Sure, thank you. Just like Tony said, we were in a healthcare organization that probably you could measure in terms of we were just really slow to adopt technology. What we found was that we were moving a little bit faster in our electronic medical record, but we didn't have any type of strategy for mobility. We didn't have a strategy for cloud. We were on an old on-prem mail system. How we accessed everything was clunky and difficult and limited. And so as we started to develop some strategies, the CEO said, I know there's a couple players out there, and he said, I want to partner with somebody that fosters ingenuity, that's willing to be a partner with us, and willing to kind of hold our hands as we go down this journey. And so we developed a relationship with SADA, and we developed a relationship with some of the Google representatives. And what we found was that they really seemed to care about us in terms of healthcare, and they weren't there just to try to sell us something. They wanted to engineer something that was specific and helpful to us. And so it was a fairly long journey. The decision didn't come lightly. We evaluated the cost, but the CEO and the board of directors finally made a decision. Probably it was about 6 months in terms of weighing the different options, and in the end went with G Suite.
Jim, what caused Cambridge Health to evaluate Google in the first place, or to consider cloud as an option?
Yeah, so we were primarily looking for cost savings. And along the way, we were in the middle of renegotiating a contract, a 3-year contract for our existing email and Office Suite software. And while we were doing that, we had the revelation that we could actually purchase G Suite for 5,500 users for less cost than it was to deliver our current solution of on-premise email. And that became the significant driver from there.
I think obviously healthcare is experiencing a lot of transformation. There's actually a lot of pressure around cost savings, and certainly not, at least not waste. And I think what we're seeing in the TCO analysis we do with a lot of our healthcare prospects and customers along the journey is that the economic benefits are clear, and it's certainly a starting point to have a broader conversation, but it certainly gets the conversation on the table. So for Elizabeth and Scott, you come from these very large organizations where decisions are difficult to be made, and sort of culturally there's a in healthcare, maybe in other more than others, there's a consensus-oriented culture around decision making. And I think for a lot of the members of the audience, I think there may be massive Google fans in the audience, and they love the platform. You guys might already believe it's the platform to be on, but there may already also be a belief that this is something that's hard to get done, as far as like, how do we get people aligned in our organization? How do we get the board to agree? How do we get line of business owners, CFO, CMO, and so on, other decision makers on board? And it seems like a daunting journey. It seems like the larger the organization, the difficult it is to get a decision made around a massive change. And it's not as big as medical records from sort of maybe a cost or project or scale standpoint, but it is the one tool used by 100% of the organization. It's the #1 used application for 100% of the employees. So I think for the benefit of the audience, I'd love to hear from Elizabeth and then Scott, like, once you decided to evaluate it, like, how did you get over the line with regards to actually signing and deciding you're going to do this?
Sure. Thank you. Well, clearly Google Colors work with my wardrobe, so that was a deciding factor. And then we went from there. No, we had actually, I've been with Leahy now 4 years, and my project, day one, was to work on communications change management for an email platform. We have 15,000 users on 4 different platforms, one of which was aging and really not supported. So there were a lot of challenges in there. And we had fits and starts to get those organizations on one platform, and we just couldn't move it forward. Some of it was a cost issue. Some of it was just getting all of the folks, all the decision makers in a room to agree. And one of our advantages is that our CIO at the time, he was a Google fan. He had implemented Google in an academic healthcare environment previously. So he had experience to be brought to bear. But what was interesting is that when he went to the board, when he went to the CEO of our organization, these folks know Google, right? They know Google through their kids, through their grandkids. This isn't so much a leading edge in a scary way, especially for healthcare, but it was familiar leading edge. So it made it a little bit of an easier sell for us from our perspective. And it's that generational piece is one not to be underestimated as you're going through your own evaluation of what you want to do with your systems.
Yeah, awesome. Quite simply, I shouldn't say quite simply, but our journey was about 18 months of assessment and discussion with leaders, evaluations. We did our own internal review of things that were going on. But the biggest thing that we really took advantage of and leveraged, which I really applaud our leadership recently, that they have said, look, we've got to be more innovative. We've got to be transformative. We've got to look for ways of doing more with less and better quality. And, a lot of times we've heard that in our past, right? Do more with less, do more with less. But then when you add on and improve your quality, all of a sudden the game changes a little bit. And so we started looking at some things about what we currently were doing. And within our organization, we had a couple things going on. Application rationalization, huge, right? We started that initiative and started looking at, why do we have 1,200 applications that actually, probably over 80% of them, we're not even really sure who the business owner is and what they're doing. I know it's a little telling, but I don't know if you guys are witnessing the same thing, but we started going through that process, and we started looking at how can we start leveraging investments that we have in different technologies to start, bettering that. So that was one of the things we started looking at, because what was coming ahead for us was now a decision about where we were going to go with our new office productivity email sort of systems, right? And so we started taking a little deeper look at what are our options and our alternatives. How can we, and this is coming from another sort of session that I went through, but it was one that talked about if you're trying to basically remove the complexity in IT, you're going to fail, right? But to simplify it and manage it as much as you can is something that we should all, as IT leaders, be moving towards, right? And try to remove a lot of what our frustration within our organization was, which is I'm spending more time on trying to be an IT person than I am trying to take care of patients, And hits hard, right? I mean, you're sitting there going, I'm the IT leader, and I need to figure out a way that these guys can be more ubiquitous. They can get to the things they need to. And when you talk about the generational gap, that's one. Our organization happens to be close to 40% millennials, which is a big deal. But on top of that, really, our providers, our physicians, were really saying the same thing. They're like, we just need to be able to get to our tools, and if it does mean our email, or if it means access to things that's in Drive, or things that make it so that no matter what, if I'm using a phone, if I'm using a computer, a laptop, anytime, anywhere, BYOD, it shouldn't matter to us. We should be able to get to those things and be able to get to taking care of our patients. And so we started tying these things together, and we took that back to executive leadership, and we said, look, first of all and foremost, yes, there's a stewardship level to this, right? Certainly a cost thing, which really gets the attention a lot of times of our executive leaders. And that was compelling enough. But then we started saying it can't just be for that, right? Because your associates are going to turn around and say, really, you're going to disrupt my entire world just for some savings? The answer is, yeah, it should be, right? Especially if you're in healthcare. Well, I shouldn't say especially, but in healthcare. And then secondly is that we started then tying those other strategies together to be more innovative, to be transformative, to now start leveraging those things so that we can reduce the cost and overhead, which, IT gets tagged a lot with that, right? You're the largest cost of our organization. Figure out how you're going to do this with less cost. So we started combining all those things together, and then at the end of the day, And just to, kind of explain to you that we did have one of the big four come in and help us with some of their assessment. We teamed up more with SADA, we teamed up more with Google, and we got the facts. And when we brought it back in, it really, at that point, executive leadership says, this is what we're doing. So.
I think great points around, we haven't seen an occasion where we've done the analysis and then implemented Google and there wasn't a definitive hard cost savings, and not even counting sort of the productivity cost savings. So I think that's a great way to broach the conversation with the CFO, certainly. The other thing that you guys both mentioned, which I found interesting, and it's something that we get reminded of a lot, and tracing back to our Google journey in the ecosystem, is really the higher education systems that were first doing this back in 2006 and 2007. I remember our first project was Northwestern University, then it was Kent State, then the UTA, and a bunch of others. And then it was like Chicago Public Schools, and it went down to K through 12 systems were going Google a decade ago. Lo and behold, you fast forward 10 or 12 years, you have 80% of higher education on Google, something like 70% of K through 12. I think Chrome is definitively the market share leader in devices in education. So you have entire generations of the workforce entering, the corporate world in which they've never really touched anything else except Google tools and maybe on a Chromebook. So with a lot of the large enterprise and in this modality of hiring and recruiting top talent, whether they're engineering talent or any other discipline, we're seeing our customers sort of articulate that being on Google as an organization is actually recruitment competitive advantage as well. So let's talk to Jason about the migration process itself. So the decision's been made, you guys are on that journey. What does that look like? Because again, it's sort of on the onset a scary proposition. You're about to rip and replace the number one application that everybody's been using every day the most for 10 years, 20 years, whatever it is. Tell us about the migration journey.
Sure. First, I got to tell you a little bit what the environment was like. So when we were exploring this, I think Scott talked about some of the adoption, and what we were a little bit worried about was the providers. What were they going to accept it? Were they going to be okay with it? And so I went to the Med Exec meeting and I briefed it. And generally speaking, the providers don't like IT because we just get in their way and they want to see patients and not be hassled. And so when I briefed it, I literally got a standing applause. And that was because they were so frustrated with some of the infrastructure we'd had. We didn't have that mobility. We didn't have the access that they wanted. Like Scott said, they just wanted to have information at their fingertips. And so, with that type of environment, actually, it made it a little bit easier as we transitioned. And so I'd say that there's two kind of aspects to the transition, and one was a technical, and the other was the cultural change. And so from a technical standpoint, we partnered with SADA, and they kind of held our hand through the migration. And it wasn't all roses. It was certainly some challenges in terms of, as we migrated all of our mail and file systems across, we had some challenges, particularly in areas. People had some strange names where they put characters and stuff in their folder names, and those were a little bit challenging. And then some of the validation, people just didn't trust that their 40,000 emails had come across, and didn't believe that the one from 7 years ago was actually in there. And so it was a little bit of technical, but really I'd say, from an organizational standpoint and from an IT standpoint, very minimal. What we're really challenged with was the education and cultural change. And so we had a lot of folks that, the only thing that they'd ever been on was a Microsoft platform. And so even getting people to come to an education class was difficult. We had the buy-in from the highest levels. Even then, it was challenging to get people to come and learn about Google before we implemented. And a lot of that, I think, is partially due with healthcare, where, our providers are saying, well, I have to see a patient. And, this Google thing, it can't be that difficult, my kid does it at home or whatever. And so I think really our biggest challenge as we migrated through that was the education piece. We offered it, I don't know how many times a day, 7, 8 times a day over multiple weeks. We had proof of concepts. We had as many people as we could involved. And even still, I think we fell short in terms of providing enough education so that when we actually did the migration, there were still some challenges. Mostly the questions were, where is this? And how do I find that email and that kind of stuff. But as I look back, it wasn't that difficult. As we look at some of our other migrations on systems, I think we were fortunate that we had an organization like SATA that was experienced in this and kind of held our hand and knew what to expect as those challenges came forward.
Jim, I know it's been a while, but tell me about your journey.
Yeah, so our biggest challenge really was resources. So we were significantly constrained on a limited budget, and we also had a very strict timeline. So we're trying to save money on our email, on-premise email, by eliminating the existing contracts, and they were all on a particular schedule for renewal. So we were trying to figure out a technical solution to be able to eliminate those products in the order they were coming up. So to give you an idea what we did, so April 2016, we signed with Google. By June, we are already running all of our email through Google. That's a little unusual for the way people implement, but we had all our email running through by June. In October, we cut over 5,500 people over a long weekend, and everyone's on Gmail calendaring and has the full access to the G Suite. So it's a little different than some people do it, but that's the way we did it. And by December 31st, we are shutting down our DLP solution. So this is some of the things when you think about on-premise email. We had an archiving solution. You have the cost of your email and licensing, et cetera, but you also have your antivirus on there. You've got a DLP solution on the back end, and we had spam filtering. We had contracts tied to all of those products, and we were trying to shut them down and not have to renew any of those products, nor were we trying to let on to any of our vendors that we were about to do this. So it was a little bit challenging with the communication. Other than that, I had a similar experience. Technically, not that much challenge. I think that was the easiest part of it, was the technical piece. In the hospital environment, I think our biggest challenge is just time for all the personnel. It's email and these tools are really not the priority of the staff. They really are all centered around patient care, and that's where their focus is. So it is very, very challenging to get people to go to classes and get the education they need to know what's going to happen when you cut over a course of a weekend. And when you've got 5,500 people, it's a big task to do.
I'm going to come back to you about some of those other benefits you're experiencing with viruses and stuff in a minute, but people are often surprised as we put together these statements of work and we do all this assessment about what the implementation looks like when they see 50 or 60% of the effort geared towards adoption, change management, and training. I think their bias in the beginning is like, this is a highly technical project, and that's sort of all the work. But over the years, we started off where in education, we didn't do much adoption at all. I mean, these are students and kids, and they'll just pick it up, and it's a different working environment. But as the enterprise has started to embrace this journey, we've evolved to it being as much about the soft aspects as it is about the technical aspects, because that is really the moment where we celebrate success, is when we see those adoption numbers and we see it being lit up across the workloads and we see people happy and that they can find their email. That's really where we measure the success. The technical challenges are pretty straightforward at this point, certainly.
Yeah, so I'll just add one thing for us. Our CEO on the Go Live, his comment was he compared it to Y2K, and he said, quote, it was a non-event. So I consider that the highest compliment, that awesome. Things went pretty smoothly for us. It's not perfect. Everybody knows there's always people who don't like change and don't adjust well, but overall the cutover went really well. And I think we did the same strategy. We've talked before. Everybody did about the same thing. You concentrate on cutting over your email and calendaring. People understand those apps. and then later on, they begin to learn the G Suite as they need it.
Elizabeth, you guys did 17,000 users in a relatively short amount of time as well. Can you tell us about that? I think people are surprised as well that this is not a multi-year project, even for an organization of your size. Because email used to be in the on-premise world. We hear organizations taking 2.5 years to migrate email. Now it's really a different paradigm. Can you talk about your experience?
Yeah, last year it was, we signed with Google in May. It was a week before WannaCry hit, if anybody's familiar with WannaCry. And our team was just coming out of being 24/7, recovering from protecting against WannaCry to go right into the implementation and the training with SADA with regards to Gmail. And we were completely implemented within 91 days with 16,000
91 days.
people. And that was 6 different, and we call them like Big Bang. They were little Big Bangs. But we opened up the whole suite. So we did focus on email, calendar, and contacts, but we allowed access to all the collaboration tools, except for sites. We did end up shutting down access to sites because we didn't feel like we had time to really provide good governance around sites, and that could have proliferated like crazy. So we only just recently are starting to open up access to sites. And we also allowed access to the extensions as well, which was a robust discussion with our security folks. And we have since dialed that back since also. But the thought process at the outset was we wanted to see what people would adopt for extensions. And they were some of the typical ones, Grammarly, et cetera. Boomerang, I think, was out there as one of the top 2 or 3. So we've since dialed that back a bit in the year hence, but it was a whirlwind for sure. And we really partnered so closely with SADA technically and from a change management perspective. And thinking about today, I want to kind of liken that partnership to like a new mom who's going in, or new mom and dad who are going in to have their first kid, right? You go into the hospital, you're all excited for the baby. You're like, oh yeah, great, you got the birthing plan, everything is going just great. And then, some things might start to feel a little bit different, feel like, oh no, I'm not sure about this. And you rely on your doctor, right, to get you through that. And you also have to rely on your intuition because you know your organization. So we relied on SADA. They've been there, done this. We knew that they could help us with the technical, and we knew they could help us with the change management. But there were some nuances that we went a little bit off the playbook. And one of those was doing 6 different implementations. We had many, many, many discussions about just doing all 16,000 at once. That was the best practice. But we knew our organization, and we knew our IT organization, which is about 400 people, couldn't support that kind of change and that kind of implementation in as high a quality way if we would have been better suited if we did it the way that we did it. And we had a lot of robust discussion about that. The other part was change management, right? So the playbook called for putting a call out for super users, people who are passionate about Gmail and G Suite, and having them come in and be ambassadors with the change. And we were headed down a path to do that, and then our CIO and our VP looked at the Leahy organization and said, you know what, there are too many competing priorities out there right now. We are not going to get the support that we need to do this and do this well. So we're going to just rely on our IT people, which was a great conversation to have because our IT people were also getting ready to implement Epic in Winchester, one of our hospitals, and they were also getting ready to do a PeopleSoft upgrade. So our IT organization was
That's not a lot going on.
Yeah, well, there's that little thing too, right? So they had a lot. So there were a lot of challenges, and from a change management perspective, you really do need to think about the people from a capacity perspective, right? And find ways to get them enthused and excited, but also acknowledge the elephant in the room, if you will, that yes, there are other priorities. For us, this leapfrogged and became the priority, and our people rose to the challenge. I have 3 of them on the front row right now, and this is, part recognition for them to be here because
Thank
they
you,
were
guys.
phenomenal. And the last thing I would say is, and they would be able to speak to this much better than me, but I think for us, one of the biggest challenges was mobility. And that whole MDM piece, and I think we're still trying to figure out the sweet spot with the MDM. But from the provider's perspective, those were the calls we were getting, in the hours and minutes before we flipped the switch.
Yeah, I think kudos to you guys. It doesn't matter how good your partner is, if you guys don't have the cultural orientation, if you're not rallying the IT organization and the adoption and communications groups to really be an integral part of the journey, it doesn't matter how good of a job we do. It takes a lot to get it right. Be nice, Scott.
And the one other thing that we did that was kind of cool, and again, this was the team's recommendation, was we set up Google benches, which were akin to Genius bars at each location and in multiple areas at each location. So not only did we have on-demand online training and classroom and online, but we also were physically located, and that was also staffed by our folks who are much more comfortable behind the screens than in front of the people. But they went out and they did it, and it was a great growth opportunity for them, and they really liked it.
So Scott, you're actually midway through this journey that Elizabeth just described. So tell us about what's going on next week and kind of what your project has been like so far.
Sure. Thanks, Tony. So it's really been about all of what you've been saying. It's interesting because one of the things that was very helpful for us is that it did start off with, well, this is the IT thing and whatever, but we actually had a couple of our executive leaders said, no, this is not the way it's going to be. It's going to be an organizational decision, and it's going to be an organizational effort. Our COO stepped up and said, I will be the executive sponsor on this, and I'm going to deliver messages. And he did, and it just really started getting people fired up. And in a good way, too. I mean, they were like, okay, hey, if executive leadership is behind this, then I'm okay with being behind it as well. And they started becoming very innovative and creative. And the next thing was a couple leaders stepped up. We actually had an organizational readiness change leader. She's just fantastic. And she goes, one of the things we need to do is build something called Change Leaders Group. And that Change Leaders Group is going to have representation from every discipline within the organization: nursing, physicians, executive leadership. It's going to have leaders from all different departments, et cetera. And not that they really are ones that make decisions, in other words, approval or disapprovals. But what it allows us to do is run things through them and say, we want to make sure that this is, we're thinking, and SADA's, we're taking their model, and it's funny because we actually called it, this is the Leahy-SADA model. And now they're all going, well, now it's the SCL Health model. So, however it's evolved with you guys pioneering
Trademark?
the way.
Copyright?
Thank you for that, first of all, because we got to sidestep a lot of minds, which is awesome. And then you guys will be able to do the same. But we've been able to then take that and apply it through this Change Leaders Group that then rolls up into another governing level, which is our executive steering. And what that has done is really created a synergy, if you will, and not only that, but it ties back to, and even marketing was said, hey, create us a theme. We call it the culture of collaboration. So it's not really, again, about the money. It's really about moving us in that innovative, transformative way that we have to act and behave. There's a lot that's coming in behind this that says, and we're going to use these opportunities also to shore up our policies, to shore up how we want the organization to now take this advantage. For instance, retention on emails. I don't know how many of your organizations are out there. It's just like everybody's got email everywhere, and it's just, and it's a risk, right? And not only that, but it's costly. I'm not even really sure. So legal stepped up and said, we're going to use this time to do it. So anyway, as I'm going through all this, there's been a lot that's been developing around more of the organizational change and how we want to behave and how to use this to leverage that and catapult off of it, if you will, to again, aligning with that transformative organization that we want to be and innovative. Really the technical side of it, they haven't really come up with much resistance around that. I mean, there's little things here and there.
It's funny.
that
It's
we've been
funny you
addressing. Yeah, sorry.
mentioned that because this is really an opportunity to sort of rebrand IT, certainly in the eyes of line of business, redefine a role, embark on a cultural transformation, but also sort of from a policy and features and function standpoint. I can't tell you how many times we're talking about the journey and all the aspects of the platform, and customers are like, we really need to be able to do X, Y, and Z. And we're like, okay, yeah, I think we can help you with that. Like, how are you doing that now? They're like, no, we don't do that now, but we really want to, now that we can. Okay, so you don't have a new policy, you haven't been doing it, but now you want to? It's a great opportunity to do that.
Yeah, and I think my message is, I don't mean to ramble on, but message is really that what we've been working on is that. It's really about how we want to use this for our organizational change and really aligning to what I started off with, which is that direction from our overall strategic pillars, if you will, which is being innovative. It's about change. It's about how are we going to act differently. And so that has led us up to what I feel like, our 1,500 early adopters, same thing with you guys. I'm like holding my breath, like 1,500 people going up. Oh my gosh. It was anticlimactic, if you will. I mean, it just sort of, okay, and everybody's
You have like 9,000 next week, so we'll see.
Yeah, exactly. Well, that's just it. Is then, but I know that if we can get through that one, at least you're not dealing with that and the repercussion of that, and then going into the 9,000. But you are right. Now, our biggest feedback on all this and what we had to adjust to. So when you asked me what are we getting prepared for, I went out and did a road show. So I've been kind of the front guy going out and talking to the leaders, the early adopters, gaining feedback. Trying to update our resource site so that when we have frequently asked questions about how to prepare for this, how do I get my MDM to work, how do I blah, 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 on and on. There's a lot of questions. As I was going out, the biggest feedback was, can we go faster? Because we too had it spread out over 6. We had core IT early adopters, and we had 4 global go-lives. We've now come back and we said, I'm not going to be the decision maker on that. I ran it through that governance I just talked about. And they said, you know what? Our biggest issue right now is really the coexistence, really just being on 2 platforms across the whole organization. Let's do it. Let's shorten this up. So we shaved 2 months off of it. And we said, okay, we've listened to the folks, given us the feedback. This is the organization making a decision. And so we've had to quickly work. So we've driven Lorena and Nina and Veronica absolutely nuts. But they have done a great job team. I'm sorry, that's the SADA team. And I tell you, those guys continue to get just kudos after kudos after kudos about how mature they are, how well organized they are, and they've been phenomenal. So
I appreciate that. So for Jason and Jim next, I mean, you guys have been on the, for a long period of time. I think what the audience probably wants to hear about is what have been the benefits that were promised. How do we deliver against that as a platform? But also some of the unexpected surprises, frankly. Like, what aspects of the platform are you using? Because there's so much with G Suite. And then what are some of the ancillary benefits that you experienced?
Sure. So the primary benefit, then, what we were really focused on was mobility. And it was interesting as you look at some of the statistics and the adoption of the mobility across our organization. It really was just a parabolic curve from the very beginning. We had mobile devices. We never knew we had so many mobile devices out there that people were going to adopt. And that was one that we had expected and has been absolutely great. There was a few that we weren't quite as prepared as Jim, and I don't think we were as educated as you were, because some of the benefits that we got we didn't realize was we could cut out our MDM contract. We could cut out some of our DLP. We could cut out a lot of these other contracts that we were really focused on email in the beginning, and that was certainly a big benefit. The other one has been the collaboration with the video conferencing. And so in the past, we'd had probably 4 or 5 different types of platforms. And from a technical support standpoint, that was difficult. From an end user standpoint, that was difficult. And so we've been able to adopt one video teleconferencing system across.
Yeah, and you just get it with the platform.
Yeah.
It's
Right,
not-
and there was no additional cost. That was the biggest thing for us, was we just kept cutting costs, and so that was really a great benefit.
So for us, we started out looking for cost savings, and we found collaboration. And I don't know if you haven't used the G Suite, don't have experience with it. That's the biggest thing, is when somebody realizes that attachments actually cost you time, and how inefficient that is. And once you finally do that idea where you share it out, a sheet, and ask somebody to edit it, and ask 10 people to edit it, and they all can edit it at the same time. And then you don't have to merge all those edits, and by the time you're halfway through merging, you've got 3 other versions of it coming in from people. So you've
it's sort of viral in that way, right?
yeah, and the people who, when they discover that and see that, the light bulb just goes on. And so for us, I really think the collaboration aspects of the G Suite were what surprised me. And I know when we made our decision to go to Google, we got a lot of pushback from our previous vendor, who was not pleased with us. And one of the things that we had a conversation, and I said to him, arguably, you could look at any of the individual tools and make the case that their individual tool was better. But you could easily make a very strong and compelling argument that the collaboration aspects of G Suite far outweigh and make the suite a much stronger tool than the individual other tools that we had been using. So I think that was one of the things. The other experience we shared with Jason is the meet. So one aspect of that is we are a diverse location, so you've got 3 hospitals and 15 health centers all around the area. It makes it a real challenge for people to meet. I know everybody shares that in their organizations that it's on the panel. So that is a real problem. We have seen an increase with people being able to make it to meetings and have more collaboration as a result in terms of your communication, because there's lots of times it was just a physical challenge. You couldn't get there in time to make the meeting, so you would miss it or couldn't participate, and now you can by Meet. The last thing I would add is just how much value Google has continued to deliver since we went live. So to give you an idea, when we went live, we had Hangouts, not Meet. It was non-HIPAA compliant.
No dial-in numbers back then.
That's right. And
Now you do.
And now it is. So it's gone from only 15 users to then 25, and then it was increased to 50, and it's also high definition and high fidelity audio. So, and then I would just go across the board, the AI, right? It's being added to every single tool in the suite. And another one was Drive. So that was a big problem for the idea of having shared documents and shared space and folders that survived individuals coming and going from an organization. So Team Drive is a really important concept for an organization, and that was added on, after we purchased. So Google just continues to deliver value.
We could talk about this topic for a long time. It's a passion of mine and certainly of the panel. Just in my experience with healthcare, you guys seem to have somehow the most collaborative culture across different healthcare organizations, different leaders. I know you guys talk, on a regular basis. I want to encourage people in the audience to really use that resource of other organizations who have made this journey first. They'll be happy to talk to you even in greater depth than what we've been able to cover on the panel. And I really love that about the healthcare industry, about how collaborative the leadership is. So definitely use that to your advantage in this conversation as well. Finally, I want to thank the panelists again. Thank you so much for your words of wisdom, for your partnership, for your encouragement. And I know your journey on the Google Cloud is just starting, just scratching the surface, and looking forward to helping you guys do a lot more in the years to come. And thank you for being here.